Hello everyone, welcome to my channel Untangle ENT. We will explore a very beautiful concept of ENT, that is pure tone audiometry, through this video. We will learn the basics in a simplified way and try to interpret and get a quick diagnosis. So let's begin. Pure tone audiometry is an audiometric test which is used for assessment of hearing, which requires an audiometer and it is represented through an audiogram. Now let's see what is a pure tone audiometer. It is an electronic device which produces pure tones whose intensity can be increased or decreased in 5 decibel steps. And an audiogram is the graphical representation of the same, which is used to categorize the hearing detection threshold for each ear separately. So, what are the equipments needed for doing a PTA? There is a machine, or we call it audiometer, which is calibrated as 0 decibel being the normal hearing, and a transducer having two cables, one for air conduction, other for bone conduction. The cable for bone conduction is placed over the mastoid process, the vibration passes through that, and the cable for air conduction can be supraoral or circumaural headphones or earphones. Now let's learn how we do the pure tone audiometry. There is a method which is named as modified Huxon-Westlake method. What do we do in it? We start with a frequency of 1000 Hz and a pure tone of 30 decibel and check if the patient can hear it. If the patient can hear it, then we go in a descending approach. That is, we go 10 decibel down until no further response is obtained. And when we see that patient is not responding, then we go 5 decibel up, that is the ascending approach, until the patient again responds. By this we get the hearing threshold of the patient, but we have to get the similar response in either 2 out of 2 or at least 3 out of 4 presentation. Then we have to check the same with all the octave frequency, that is 1000 Hz, 2000, 4000 Hz, 8000, then again 500 and 250 Hz. Now let's get some basics. As we all know, this is a quantitative information which is the accepted grading of hearing loss. Where we know 0 to 25 decibel is normal hearing, 26 to 40 decibel is considered as mild hearing loss, 41 to 55 decibel as moderate hearing loss, 56 to 70 decibel as severe hearing loss, 70 to 90 decibel as very severe hearing loss, and more than 90 decibel as profound hearing loss. Now let's know how will we assess the outcome. There is a symbols used in the graphs. For air conduction, there is different graph, and for bone conduction, which is unmarked, we will read about the marked section in some other videos. But for unmarked conditions, we use a different symbol. For right, remember it is red color. R for right, R for red, R for round. So air conduction is given as a red color round, and the left side is given as blue color cross. And for bone conduction, it is a red triangle, and the left side is a blue triangle. Now about the graph, when we see the x-axis represents the frequency and the y-axis represents the decibel or the intensity of the sound. And this line shows the normal hearing or the 0 decibel, and this is the 1000 Hz from where we start the assessment of hearing. Now how to interpret a PTA? Before we know that, let's get some very basics. First, the air conduction. Air conduction pathway is via air from the environment through the pinna into the external auditory canal via the tympanic membrane into the medullary cavity and the ossicles, passed into the inner ear in the cochlea, then through the eighth cranial nerve to the auditory pathway to the auditory cortex. So air conduction is the measure of degree of hearing loss. So via the air conduction graph, which is represented as a red circle or a blue cross, we will know about the degree of hearing loss. Now, whereas the bone conduction, the pathway is different. The vibrators are placed over the mastoid, which is the skull bone, which is passed directly to the bony labyrinth or the cochlea. Then it goes to the eighth cranial nerve, auditory pathway, and auditory cortex. Therefore, bone conduction helps in differentiating whether it is a conductive hearing loss or a sensorineural hearing loss, because the pathway from pinna, external auditory canal, tympanic membrane, and medullary cavity, this pathway is not present in the bone conduction cable. So whether it is a conductive or sensorineural hearing loss, the differentiation can only be done by the bone conduction and not by the air conduction. Now here's a very basic formula for the quick identification by seeing the graphs. If we can remember this, then it is well and good. We can very easily identify and interpret the graph. For a conductive hearing loss, the air conduction threshold should be at least more than 30 decibel, bone conduction threshold should be less than 20 decibel, and the air-bone gap should be more than 25 decibel. For a sensorineural hearing loss, air conduction threshold should be more than 30 decibel, bone conduction should also be more than 20 decibel, air-bone gap will be less than 20 decibel. And for cases of mixed hearing loss, the air conduction threshold will be more than 45 decibel, bone conduction is more than 20 decibel, and AB gap should be more than 20 decibel. So now we will learn how to interpret the pure tone audiogram based on our gained knowledge. So see this first chart, what we can see. First, the color, it is red, therefore it is of right ear. Secondly, see it is circle, circle is for air conduction. The air conduction is around average of 40 decibel, which is mild hearing loss. Next, see the bone conduction. It is within 25 decibel, which is normal, and the air-bone gap is more than 25 decibel. Therefore, it is considered as mild conductive hearing loss in the right ear. Now see the next one. Next one, again you see it is red color, therefore right ear. See the ear conduction, it is around average of 50 decibel, so we know it is a moderate hearing loss. Next see the bone conduction curve, which is more than 20 decibel, and the AB gap is less than 20 decibel. Therefore, according to the table, this comes as moderate sensorineural hearing loss in the right ear. Now see the third one. Again red color, right ear. Air conduction, it is an average of 50 decibel, therefore moderate hearing loss. Air-bone gap is less than 20 and bone conduction is more than 20. Again it becomes moderate sensorineural hearing loss. But look at one thing very nicely. This is a descending type of graph. In the higher frequency, the graph is in a descending order. This is mostly seen in case of ototoxicity. Okay, now see this graph. This is blue, therefore it is of left ear. Air conduction, again you see an average of 70 decibel. It is severe hearing loss. The bone conduction is more than 20 decibel and the air-bone gap is less than 20 decibel. Therefore, it is severe sensorineural hearing loss in the left ear. But look at the type. There is a flat type of graph. When do we call it a flat graph? When there is less than 10 decibel up or down per octave. It is mostly seen in presbycusis or age-related sensorineural hearing loss. Now see this blue color, again left ear. Air conduction is an average of 35 decibel, therefore mild hearing loss. Bone conduction is less than 20 decibel. Ear bone gap is more than 25 decibel. So it is mild conductive hearing loss in the left ear. But look at one thing. There is a notch at 2000 Hz, a dip in 2000 Hz. That is called as a Carhart notch. And this type of graph is mainly seen in case of otosclerosis. This notch occurs in case of in the bone conduction curve. Now look at this one. This is again blue, means left ear. AC, air conduction, is an average of 60 decibel, which is severe hearing loss. Bone conduction is again more than 20 decibel. AB gap is less than 20 decibel. It is severe sensorineural hearing loss in the left ear. But see, this is a trough type. This typical pattern is found in congenital rubella syndrome. Okay, now look at this. This is red color, right ear. Air conduction is an average of 50 decibel, therefore moderate hearing loss. Bone conduction is more than 20 decibel and AB gap is less than 20 decibel. Therefore, it is a moderate sensorineural hearing loss in the right ear. But look at one thing, there is a dip at 4000 Hz. Both the air conduction and bone conduction graph has a dip. So this is typically seen in case of noise induced hearing loss. Now check this one. Blue color left ear, okay. Now the air conduction is an average of 60 decibel, therefore severe hearing loss. But look at the bone conduction and the AB gap. The bone conduction is more than 20 decibel and the air bone gap is also more than 20 decibel. So this is a condition where there is severe mixed hearing loss in the left ear. Here are a few PTA for you to interpret, but before that, just a summary or gist I can tell. I will give you a recap. Suppose you get a graph, you see the air conduction. Air conduction is for the degree of your hearing loss. Now you will see the gap between air conduction and bone conduction. If there is a very large gap, think of either conductive or mixed hearing loss. Now check the bone conduction curve. If it is within normal limits less than 20 decibel, then it is a conductive type of hearing loss. But if it is more than 20 decibel and there is a large gap between the air conduction and bone conduction curve, then it is a mixed type of hearing loss. Next, if there is no gap between the air conduction and bone conduction curve, both are together less than 20 decibel apart, then consider it as sensorineural hearing loss. The red is for right ear and blue is for left ear. Now here are a few questions for you. So good luck and answer these questions in the comment section. I hope this video helps you to read and interpret the pure tone audiograms quickly. This will help you in your exams as well as your clinical practice. Have a great day. Please like, share and subscribe to my channel for more such educational videos. Or you can comment the topics you would like me to make a video upon in the future videos. Thank you.